Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
Today's guest is the one, the only, the fiercely outspoken and passionate Dr. Tro. Dr. Tro is a physician, board certified in internal medicine and obesity medicine. His own health journey involved losing 150 pounds and reclaiming his health by ignoring much of the conventional medical advice. Dr. Tro's clinical focus includes diabetes, obesity, hypertension, hyperlipidemia, metabolic syndrome, and PCOS. His approach begins with intensive lifestyle changes, including diet, exercise, improved sleep, hygiene, as well as stress management and mental health. His goal within his medical practice is to get his patients actually healthy, free of chronic disease, and off of medications. And what's really cool is that he uses health coaches extensively to ensure his patients can implement and adhere to the necessary diet and lifestyle changes needed to effectively turn back the clock on metabolic dysfunction. It's a pretty intense conversation, and we get a little fired up and emotional, so hang with us. We'd love to have you screenshot your podcast player and tag us on Instagram at Health Coach Radio. By the way, the show notes for this episode and all previous episodes of Health Coach Radio can be found at primalhealthcoach.com/radio. Enrollment is now open for the fall semester of the Primal Health Coach Institute Level 2 certification course, an advanced coaching course that teaches you how to create transformational coach-client relationships, which in our mind is the best way to grow your coaching practice. So not only will you learn and practice advanced coaching skills, but this course also satisfies the educational requirements to enable you to sit for the NBC HWC credentialing exam so you can become a board-certified health and wellness coach. Fun fact, PHCI has a 100% pass rate for the board exam. Every one of our graduates who've sat the exam have passed it. Stay tuned to the end of the show to learn more, or visit primalhealthcoach.com/level2. We think you're really going to like this episode, so let's get on with it. Please welcome Dr. Tro.
All right, Dr. Tro, I've been looking forward to this conversation for a couple of weeks. Thank you so much for joining us.
I'm happy to be here. I'm very happy to support. As you know, our practice has health coaches, so very happy to be here.
Oh, fantastic. Yes, I know that your practice has health coaches because I follow you. But for the purpose of our audience who may not know who you are, would you mind giving us the 5-minute backstory on you, your background, and kind of what led you to where you are today?
Yeah, look, where to start? Okay, so obese my whole life. Chubby kid, chubby adolescent, had a bit reprieve with a crazy stint of anorexia and then veganism when I was an adolescent, and then just put all the weight back on by the time I got to through college, med school. And then, I was a 350-pound medical student. And what I learned in medical school was eat less and move more. And I tried it for years and it really didn't work. There's no insight, no help. I went on to residency in internal medicine. I was the chief resident in the Yale affiliated internal medicine program. I got board certified in internal medicine and still 350 pounds. And I had access to the smartest doctors in the world who basically said, why aren't you eating less calories? So this was the paradigm that, this was the primordial ooze, just a lifetime of suffering, basically, and really incredibly smart, so to speak. I scored on the 99th, percentile on my board exam, on my internal medicine board exam, but I didn't really know how to live. I didn't really know how to get healthy. I knew medicine really well. And I have an amazing wife, and she's just, that's a whole another part of the story, but she knew how to play me like a fiddle. And I remember I was finishing my chief year. She like played to my ego and said, you're a smart doctor. I remember I just made like 2 just diagnoses that a bunch of other people missed. And she's like, look at what you just did. You diagnosed these 2 things. And, why can't you figure out why can't you become an obesity expert? So this is about 8 years ago now. And she knew exactly what to say. I guess I'm predictable, and she knows her husband. So I was like, yeah, you're right, and I went to the literature. I'm like, okay, I'm a 350-pound doctor. If this was pneumonia, right, I would go to the literature and see which drugs do better and what are the side effects of those drugs. And, I would go to the primary literature. So I went to the literature and I'm looking at the head-to-head studies, and study after study just shows that low carb does better. Right. And I'm like, what the hell is going on here? Like, this is not the whole grains, fruits, and, starchy vegetables that they told us to eat and to avoid meat. Like, a low carb diet is not that, but yet it keeps doing better. So I read in that year before I started dieting, I read probably 1,000 papers, just primary articles on nutrition. Again, really inspired and punked by my wife when she was pregnant with our 3rd kid. That's really where it started. I read 3 textbooks on obesity. I've read 400 books by all scopes, Mark Sassoon's books, obviously. And I've read vegan books from Gregor, and I've read, the calorie books, and I've read the low carb books. I mean, Lane Norton, all the people I disagree with, Guillain and Poncer. I've read everybody, right? I read them all. And I said, okay, I can do this now. I have a good sense of what the literature is. And within the next 3 years, and this was like 7 years ago, I then lost 150 pounds just following the evidence, right? And this was so I lost the weight, literally like, just a typical 350 pound guy, and I lost 150 pounds. And I said, I can't keep practicing the same way I do. I got certified in obesity medicine, and I had to leave the traditional system because I couldn't keep sending people to the nutritionist and the dietitian knowing that they really wouldn't get good help. I couldn't keep sending them to the endocrinologist when they had diabetes, who really wouldn't understand how to treat blood sugar issues, right? They would just recommend more of the same. So I had to, go off on my own. And I started this practice here about, 4 or 5 years ago, just doing online medicine, right? So literally, like, here's a scale, we'll send it to you. Here's a blood pressure cuff, we'll send it to you. Here's a blood glucose meter that links up with us, we'll send it to you, and we'll get all the data. We were the first practice to integrate with Keto Mojo, right? Which is the blood ketone meter company. We were the first practice to approach Abbott to integrate the CGMs, to get the direct access to that data from the continuous glucose monitors, right? So, we have now thousands of patients where we monitor their weight, their body fat, their lean mass, their water weight, their blood pressure, heart rate variability, ketones, continuous glucose monitor, even temperature and pulse oximetry, all remotely. We do sleep studies completely remotely. We can monitor your whole heart with an EKG completely remotely, like you're in your home. So we're able to basically give complete medical care for people who want to transform their lives. And we have deeply ingrained health coaching into that medical weight loss program that we have. Basically you're meeting with a health coach almost every week for the first several months. And then you are going to meetings that our health coaches run. We have several small groups that our health coaches run, and then we have a big kind of community group. So health coaching has been very integral to just delivering excellent care. And, that's been our passion. And we've been big on data and big on how do we inspire behavior change? How do we inspire people? And then how do we take them away from the system of doctors and like Weight Watchers apps that are basically just trying to, that are a recipe to fail.
Yeah.
And here's the last part of it. We watch those scales even when you're done with our program, right? So like when you're struggling, a year later, our health coaches reach out to you. Like, can we help you? Is there something we can do? We noticed that the water weight is back, or that the scale looks a little bit different. We noticed you took a ketone meter and there wasn't any, ketones. Can we help you out? So one, we've become, we don't ever want to lose that contact. If you're at home getting on a scale, why wouldn't we want that data? If you're at home measuring your ketones, why wouldn't we want that? I mean, we can affect behavior change for years, for a lifetime. So that's been the vision. And it all started with my wife saying, you big dope, you can figure this out. And I've been there. I've been in those shoes. I know like what it's like to work 80 hours a week and be 350 pounds. I know what it feels like, and what it feels like when you walk into the judgment from other doctors, the judgment from, you just see these, thin trainers and stuff like that. And you just, so we've made it ridiculously easy. Stay at home. We'll track everything at home. You don't have to get dolled up and come to the office. We'll measure everything from home. We'll treat you. We'll get a trainer for you from your home. We will contact you when we think you're struggling and just see how you're doing, to check in on you. I mean, we want to make it easy for people to do this. And we know, like, look, I'm going to be honest with you. I would go from one fast food place to the other and hide the wrappers.
Right.
I would, I would eat a box of cereal and leave just a little bit in it to make sure that I didn't seem like I finished the box. So I know that when people are struggling, they will not reach out. And we also monitor for that. When you don't step on the scale for a month, like, hey, can we just see how you're doing? Like, it's us, you spend 6 months with us. We know you, you know us, you can trust us. Can we help you out? So a big part of this is, how do we do it differently than all the idiots that have watched this obesity and diabetes epidemic blossom for the last 50 years? That's been the passion. And, we have two amazing health coaches, and health coaching is so critical to delivering excellent care. I mean, it's just the reality. That's kind of where we're at. I know that's a lot more than you wanted me to.
No, it's perfect.
Say, but...
Well, one little point of clarification on your origin story. So you went to the literature when you decided, when your wife cajoled you to become an obesity expert. And what you said was study after study showed that low carb does better. But you did your due diligence. You read obesity textbooks. You read every single other health book ever written that had competing priorities. Did you go into this research with any confirmation bias, or were you just like a sponge? It was just like, I need to understand it from all sides.
Yeah. So, well, I guess the bias that you'd have is I tried to cut my calories my whole life and failed. So that's a bias. I did veganism and escaped. So that's a bias. So those are bias. But no, literally I said to myself, okay, wait a second. Why don't I treat this like pneumonia? What would I do with pneumonia? I would go look at what drugs work to treat pneumonia, and which ones work better and which ones work worse, and why do they work better and why would they work worse, and what are the side effects, right? I mean, that's what I did. Okay, why, what are the patterns here? What drug in the head-to-head studies, what typically does better and why? So, I mean, there's always a bias. I'm human, right? And I guess you could say I'm a little more biased because if I could have controlled my calories, I would have, right? So that there's that bias. And I did veganism and I was ravenously hungry and mentally unwell. Right. So there's that bias, but that's supported by data in and of itself.
Yeah.
So I don't know, there's a bias, but I don't think, I think it's, I don't know how to, does that answer it enough?
It does. But the reason why I asked, just to give you the context, is because, we want to speak to the evidence-based folks who, those guys who
Told me to cut calories and just eat.
yeah,
Why can't I just eat
exactly.
less?
Exactly. And the struggle, so my understanding of evidence-based is there has to be research to back it up. There has to be clinical experience that suggests that it's possible. And then it has to be within the values or doable to the end user, the health consumer, essentially. But nobody's talking about those other two things. They're just, well, the evidence is this. And it's like, but in implementation, just eating less isn't working. You just counting your calories is not working. So I just wanted to speak to that, just to address the evidence-based folks that you didn't seek out low carb because you're a low carb zealot. You were really taking in all the data, but also folding in your clinical experience and your lived experience.
Look, the bottom line is they failed.
Right.
Okay. So if you want the true evidence, if you look at meta-analysis after meta-analysis, low carb does better by a couple of pounds. Okay. Well, the reality is this, right? They do better by a couple of pounds. So, and some could argue that it's water weight, right? Some could argue that it's water weight, and it's a legitimate, but at the end of the day, if you joints hurt and you can't sleep, I will take 3 pounds of water weight any day. Okay. So first and foremost, it does better consistently, right? Nominally. So it's not like the supreme thing of all diets. Now, if you look at how it is, what happens over 6 to 12 months on any diet is everybody reverts back to the baseline. Okay. So if you look at trials like Diet Fit study that looked at really healthy low fat and healthy low carb, at 12 months, there was about 1 teaspoon difference of sugar between the low fat and the low carb diet. I mean, just to give you an example, they were like equal. They're basically coming back to the same. So, and what does that mean? It doesn't mean that all diets work the same over time, right? If you go back to that person at 12 months who equalized and said, here's the CGM, let's see what all that sugar is doing to your body, and they get re-evangelized, right? Then they'll see a whole new set of results. So what the evidence-based crowd, what they confound is they say that everything's the same in the end, right? Which is true because everybody reverts to the modern food in the end because we fail to inspire them forever, right? We fail to keep them going. So because everybody fails in the end, they believe that all diets are the same. And it's a false belief. They're not the same. If you take that person for 12 months and give them, and reinvigorate them to diet and have them cut their carbs again, their blood sugar is going to improve. Unless you believe that, cutting carbs doesn't improve your blood sugar, which is just anti-science, right? So the problem is the data is being misinterpreted. Okay. The data is being so they look at that data at 12 months. There's no difference. There's no difference. You can do whatever diet you can adhere to. And that's true. If you can't adhere to a diet, if you can't live, if your life cannot live without X, Y, and Z food, then yes, you have imposed a psychological preference that may exclude a diet, right? But all diets aren't the same. That's bullshit. Excuse me. It is. And that's the problem with the evidence-based crowd is they have a correct, they're discussing the data correctly and interpreting it incorrectly.
Well, and they're only looking at, to use Aaron's point, they're only looking at one source of evidence is what it says just in the literature, and then taking a look at what is the lived experience of these people and their ability. So, I've heard you talk repeatedly, right? And I've seen this, on your Twitter posts and things, talking about just the tremendous importance of satiety in a diet, right? And Mark Sissonal will say the same thing. The death knell of any dietary approach is hunger and cravings. It's done. You're done. So we're ignoring, you've got one, like, here's the clinical evidence that says, okay, either approach in a vacuum where somebody's formulating the entire diet for you over a short period of time, that the outcomes look similar, but they're not looking at the actual lived experience and how these people do, again, with the approach that you're taking, ongoing support. And I love the term that you used, inspire. We'll often use the term as coaches, empower, but to a certain degree, I kind of like Inspire a little bit better, to be honest with you, right? To kind of take ownership for themselves and run with it for long term. Nothing irritates me more than, but the science says. And my question is like, who's science? Who's actually putting this together? And is this happening appropriately in real life? That's the one thing that's missing. One of several things that's missing.
Let me tell you right now, their interpretation of the science is just, it's outright lies. Mm-hmm. So I just want to let you know, for example, we just got a study accepted, right? First of all, they said you can't do low carb if you have an eating disorder. We took binge eating patients, gave them low carb, and we literally documented that their binge eating symptoms improved. Yeah. Then they said, you can't do low carb. This is a National Lipid Institute. You can't do low carb if you have high triglycerides. We literally took patients with 1,000 triglycerides, put them on a low carb diet, showed that it improved. Then they said weight loss is the reason why low carb works for diabetes. And we literally took patients that showed an improvement in their blood sugar in 2 weeks with no weight loss. And again, their A1C improved. And I want you to hear this, an A1C of 12 to an A1C of 6. Okay, in a 4-month time, off of insulin, off of all medications, okay, 3 patients with only 8 pounds of weight loss, which did not meet the ADA's, criteria of 5%, right? Which is what they consider to be, if you look at the ADA's recommendations, they say, it doesn't matter what macronutrients you have. It doesn't matter when you eat your food, meal timing doesn't matter, as long as you decrease energy and lose weight. So we literally told these patients, don't count your calories, don't control your portions, and we don't care if you gain or lose weight. We just want to see, can we help your blood sugars out? And in fact, one of them didn't want to lose weight, right? One of them actually said, look, I'm a little underweight and I'm a little older. I don't want to lose any more weight. So what do we show? Literally did not require weight loss. It required to come off of insulin, required no weight loss, just lowering your carbs, and literally ignoring everything the ADA says. So the problem is not only are they wrong, they're lying, right? Do they know they're lying? I don't know. They have data to support that weight loss does help. It's true. Weight loss helps diabetes. It's true. Okay. It is true that you can eat a low-fat diet and eat like a rabbit, 400 calories a day, and you will lower your blood sugar. Okay, but it's the carb reduction that's improving the blood sugar in the short term. Right. That's what it's doing. And we've shown that. We accept, the paper is accepted, and they'll probably come from my head. So their science is off. Okay, their science is wrong. And the problem is we're tracking the data now. They're not. Right. We have, we're the biggest prescriber of continuous glucose monitors. Right? So we've prescribed over thousands of continuous glucose monitors. We have more data than they have. Mm-hmm. There's been one study that published findings from 8,000 CGMs, and that was just this week. They're the second biggest group after us that's been analyzing CGMs, right? And what do they find? Massive blood sugar fluctuations make people more hungry. Right. Well, anybody who's eaten pizza knows that. Why is it 3 hours after eating pizza, you're hungry all of a sudden again? You could eat cold pizza and it tastes better. Why is it after Chinese food, right? 3 hours later, you're like, wow, I could finish all that Chinese food leftovers that I had. Well, we know this now with data. We knew this before, right? David Ludwig showed that with the data that your blood is literally robbed of total energy if it's a high carb meal, right? We've known since 1999. Okay, we've known since 1999, if we take 2 shakes, right? We fill up like something like this with a shake, right? And one is the same taste, same volume, and it's just carbs, same taste, same volume, just fat. And we give it to you. And we say, let's see when you eat next. The people who had the carby shake will eat within an hour. 1 hour later, right, after that blood sugar is crashing back down, right, 1.5 hours later, they're going for that second food. They're going for subsequent intake. The people who had the fat, right, they don't care. 2-3 hours go by, and then maybe they initiate refeeding, right? So the problem is we've known this, okay? And anybody who tracks this stuff or even just talks to people like you're saying, what is the lived experience? How do you feel after eating 10 eggs? I can't even imagine eating. That's the same amount of calories as 2 slices of pizza, right? How do you feel after 2 slices of pizza? I'm ravenously hungry 2 hours later. So if you listen to a patient, you had the data before the literature had it.
That's right.
Okay, if you listen, to somebody, you actually had the data before the literature had it. If you needed the literature, it's there now. It's been there since 1999, but now we have it in 8,000 people wearing a CGM. And here's the reality: before last month, when this was published, we had this data for the last 4 years. So clinically speaking, just by talking and observing to patients, we've had this data. We're not able to publish it. We're just a small team here, right? We're like 5-6 people in this office. So this whole science thing, it's bullshit. Yeah. It's all bullshit. Okay. So that's my opinion. Sorry.
Well, and just a little anecdote to your pizza versus eggs theory. Like 2 pieces of pizza for my husband. Oh no. There's no way he's stopping at 2 pieces of pizza. He's eating 4 at a minimum, right? Versus 10 eggs. There's no way he would choke down 10 eggs, right? In a million years. So there's a lot to be said for the hyperpalatability of these foods, and the satiety that it brings to the table is what makes all the difference in the world. Just that one little offhand example is
and
not the perfect illustration.
So you get satiety within the meal, right? And that palatability and satiety within the meal, but then what happens next?
Right.
Right. So what happens, like, okay, he ate half the pizza, 3 hours later, he's eating the cold pizza and it tastes better.
Exactly.
Why does it taste better? Nobody's answered that question. Why does Chinese food leftovers taste better? And they said, oh, it's the MSG. That's bullshit. It's not. Okay. It's the blood sugar going up, then falling back down within 1 to 2 to 3 hours, depending on how diabetic you are. And that reactive hypoglycemia makes you hungry. It makes you want more. No, none of us would eat cold pizza. If we went to pizzeria, they gave you cold pizza. What would you say? Like, take this back. Right? If they gave you cold Chinese food leftovers, what would you say? You'd be like, what the hell is this crap? Right? But we actually crave it more. And it tastes better. Nobody has paid attention to this, even though so the data's been there. If you're a coach, you know this because you listen to a patient.
Right.
Right. But you just, like the evidence blowhards, excuse my language, but the evidence blowhards, they don't see patients. They don't see people. Sorry, you got me triggered.
No.
You know how
Honestly,
to trigger me.
you
know how to trigger me.
Yeah, I mean, I think the new term is the EBIT, the evidence-based internet troll, EBIT.
I like it.
But yeah, that's one of my beefs with them too. Is like, who are you even working with? Who are the people that are sitting in front of you? Because, when you were talking about your story again, your own journey through of being an obese person. It was reminding me of my mom. Okay, hear me out. So my mom would hide food wrappers. My mom was very, very obese. She also had a lot of other metabolic illnesses and just, chronic back pain, anything that would come with being a very obese woman. And she got to the point where she wouldn't go to the doctor for things that were coming up, because anytime she set foot in the doctor's office, the only thing they would say is, well, you need to lose weight. They wouldn't even draw blood. They wouldn't even run a panel. They wouldn't even address her presenting concern. You just got to lose weight. So she stopped going. Mm-hmm. And so I get really annoyed by first of all, people fighting about evidence, because it's like, what about the person in front of you who's not having a supportive experience at the doctor's office and is just being looked at as this big fat person that has a problem with controlling their calories? I mean, my mom had behavioral problems in the sense that she was hiding food and whatever, but she also had a lot of illnesses that went unchecked, and ultimately she passed away early from
why did she hide the food? I'll tell you why. Okay, why did she hide the food? So this is important. She had shame and guilt, okay, which is literally a symptom of addiction, and she had nowhere to turn to. Right? She had nowhere to turn to. And what we tell every patient that walks in here is, at the least, we're a binge eating hotline.
Yes.
You're like your car. If your car has a problem, how quickly do you call AAA? Right away. Everybody's like, right away. Well, if your appetite is out of control and you find that you're eating ice cream and hiding it, who do you call? Right. Nobody. And if you tell anybody, if she goes to her doctor, first of all, she walks in, she walks in and the seats have arms, right? She can't even fit in the seat. Okay. They're sneering at her and they're probably making jokes about her. And then when she gets on the table, right, she gets up on the exam table, it probably cannot even support her weight. So the weight bias is like implicit. And even if you had the courage to reach out for help, what would they have said? They would have said, eat less and move more, right? So the problem is your mom was all alone, okay? Because there was nobody that could have addressed her, nobody, right? Maybe she wouldn't have went to like a counselor who would have worked through that shame and the guilt and the feelings of that, but then no nutritional advice. Right. And in fact, the nutritional advice would have probably caused more shame and guilt when she failed it. So you know what you're describing here, it's literally everybody that walks in this office, literally every single one, including present company included.
Yeah. Oh my gosh. It's so powerful. I know, just being able to talk about kind of these experiences and as a coach, you know, Erin and I, just the people that we work with, I haven't worked with people as overweight as the people that you're working with, but Erin and I both work mostly with women, and the whole body image, negative relationship with food, shame around food, these are all rampant. The only difference is typically the women that we work with, I can't speak for Erin, but the women that I work with, thank God, found me before they got that far. Or perhaps genetically, they were never going to be that big, but they're still overweight. They still have a good 50-ish or, 20 to 50 pounds probably to lose. And so I think a lot of people, even if they're not 300, 400 pounds, can relate to those feelings of shame around overeating and these feelings of, I just lack self-discipline. What's wrong with me? And it's being able to have the conversation. That's nothing wrong with you. Your body's telling you something. Listen to it and let's talk about it. And this is the role of the coach and the collaborative physician that you appear to be.
Yeah, look, so, I'm going to tell you, we've seen it all. We've seen people. So I've had a patient come into my office, just totally bucks the trend. Most people, it's postmenopausal women. That's the most, just the demographic coming to us. But we had a young 20-something-year-old with a 6-pack come into me and say, I need your help. And I'm like, what do you mean? What are you doing? This is weight loss. You do, okay, primary care. Maybe you have a cold or something. He's like, no, I have a problem with food. And I'm like, well, what's going on here? He has an incredible problem with food, binge eating. His appetite is out of control. Okay. And he's just compensating with exercise. And he's like, I don't know what's going on. Right. So it's not just like the postmenopausal woman who's struggling to lose anywhere, I don't know, from 20 to 300 pounds, and we've seen them all. It's everybody. I mean, I've been struggling since I was, as long as I can remember. And, so other people just deal with it in different ways, and in this case, it was anxiety driven. And I mean, his triglycerides were through the roof. He had leptin resistance. I mean, like everything. And on top of it, and then it didn't take much. Because when you're that lean, it's like, you're less, the small changes go a long way, right? It didn't take much, but there's a lot of people suffering. There's nowhere to turn.
Yeah.
That's the reality, there's nowhere to turn. And here's the reality. Here's the other sad reality is, you said with a lot of weight to lose, but I mean, 40% in this country are now obese.
Yeah.
40%. I mean, it's everybody. Everybody has this problem. That's if you ask my honest truth, I think maybe 10 to 20% are like my wife, who have like no real major appetite. They'll never gain a ton of weight. And, somehow she'll just manage to be petite her whole life. Right. But in terms of, if you look at the demographic, 88% have some component of metabolic syndrome. 2/3 are either pre-hypertensive or hypertensive, 2/3 are pre-diabetic or diabetic. So I think it's a lot more people suffering. We just don't, the stigma is so strong, it doesn't come out.
Yeah. Well, the story of the young person with the 6-pack is interesting because actually some of the what you shared earlier about how appetite presents when you're kind of in this glucose dependent sort of tailspin, it was totally flashed me back to my pre-diabetic days. It was like, man, I can't believe I lived like that. But so what I work with people now who are on two ends of the spectrum. I love working with the very, very obese people like my mom. It's just a personal passion project of mine. I find it really rewarding and I want to help. I wish I could have helped my mom, that sort of guilt. But the other end of the spectrum is the effortless relationship with food. And so this is the again, the lived experience of the person who's not yet obese. They've managed to prolong the inevitable by just overtraining, training, or, crazy caloric cycling, or over leveraged, metabolically. But their whole life is consumed by food. And I'm getting more people like this who are like, I actually don't care if I lose this weight. I've got 5, 10, 15 pounds. I just need to stop thinking about food all the time. I'm just constantly thinking about when the next meal is going to be and what's it going to be and how much of it's going to be, and get my 6 ounces of chicken breast. And then I'm binging late at night because I wasn't ever at any point in this day satiated appropriately. And there's an interesting appetite, like this person who came into your office. I'm seeing that more in my practice too, which is, I think, quite exciting. Almost like there's become a paradigm shift, and people are realizing that this micromanagement and this singular focus on calories and tracking them hasn't worked. I mean, look around. So it's pretty exciting to kind of be on any end of the spectrum, I think, of this metabolic sort of.
Well, I think what you're pointing to really is the mental health components of diet, which have been ignored by the literature. But now, in the past 10 years, what do we have? We have interventional studies with real food that shows that mental health improves. We have low carb studies showing that you can decrease migraines, you can decrease seizures, you can improve mood. We have interventional studies showing that. Okay, we know from the crappy, food frequency questionnaires that not eating meat is associated with poor mental health, right? So we know that, but actually we have interventional studies now showing that, just a low carb diet, just switching out, there was a study that just came out within this year that showed if we gave people, almond flour based and almond based, right? If they just swapped out their crap food with foods made with almond flour, that their depression scores improved. We have a study from the NIH that took people on a ketogenic diet who were in alcohol withdrawal and showed that they had a decreased need for seizure medications, and they had a decreased desire for food. Decreased desire for alcohol. So we know unreliably exercise has been shown interventionally to be as potent as an antidepressant for depression. So we know that lifestyle is intimately affecting mental health and separate from metabolic health, right? We know metabolic health makes it worse. Right. But these people you're talking about and the people I'm seeing have anxiety, depression, and just consumed by like an appetite they don't understand. Right. I'm telling you, the next paradigm is mental health. And we already have enough data to say improving your diet, exercising will literally improve your depression and anxiety. Okay. It may even decrease your need for alcohol if you're dependent on alcohol. And that's studies from the NIH. So again, this is the problem. If you talk to evidence-based idiots, they'll say, excuse my language, they'll say that, there's no diet that does anything for mental health. Like the calorie, it's just calorie, right? That's also just bullshit.
Yeah.
Sorry. Now you're really triggering me.
No, let it fly. Let it fly. It's completely fine. Look, my poor husband, Aaron. I talk about him all the time on here.
Brad again. Oh,
I do. Well, because he's my husband and he's my second husband. We've been married 8 years or so. And he has suffered from anxiety, depression, and ADD, ADHD his entire life. And he is now sober, about a little over 7 years sober, from alcohol. Yeah. I mean, that's not a long story, but a little bit of a story about what made him quit. But he will be the first one to tell you that eating poorly, and he describes eating poorly by too much processed food and too much sugar, triggers his anxiety and his addiction, right? And he's the kind of personality that can be addicted to pretty much anything. It's not just alcoholism. He's got the addictive tendency, and he'll be the first one. He'll come in and it's running rampant. He's got to pull the sugar out of it. And exercise, we're both in fitness, both of us, but exercise, I think for a long time, he played soccer at a very high level. And I think that kind of helped him from literally, I think it saved him from killing himself. Right. But it was not enough for him to not have those anxiety symptoms, those depressive symptoms, until he really we got together and I ate a certain way and he just ate what I made him because he was too lazy to get his own food, and a huge difference, noticeable difference in his mental health.
Yeah. And quote unquote, evidence-based, dogmatists have ignored it. They really, really have ignored it. And we have the data now for the last 10 years. If you look through the literature, it's there, strongly enough to say concretely, we have interventional studies, and I'm not talking about crappy food frequency questionnaires, population-based studies, which have shown that meatlessness is associated with poor mental health. That we kind of knew. Okay. But now we know low carb diets interventionally improve mood. Okay. Improve depression. All right. Improve anxiety symptoms. Right. So we know that. I'm glad to hear your husband's in a good place. And, just to come back to the exercise and the role of exercise, if you look at what, Atkins said this, there's 4 ways to Valhalla. There's 4 ways. Either you're going to get metabolic flexibility, fasting, exercise, low carb, or being lean, right? I mean, my son, who's 9 years old, an overnight fast, his liver is tiny, right?
Mm-hmm.
An overnight fast is enough to put him into ketosis, right? He doesn't need to do much. He doesn't have excess adiposity, right? He's lean and he's small and he's in ketosis overnight. So Atkins, he knew what he was saying, 30, 40 years ago. Being lean and exercise is enough for some people. Okay. But when high school gym class is over, that becomes a problem, and the other ends of that are intermittent fasting and low carb. Do you need to do all of those? No, you could pick any 2. Some people need 3, some people need all 4. I need all 4. I have to push down on all 4 of those to be my best self. So I'm with you. I'm glad your husband is he still playing soccer?
Not professionally like he was. He actually loves training youth athletes. He loves doing that. So I'm encouraging him to follow through with that, because for him, mental health is again a big part of it. He is the first one to tell you, if I was mentally in a better place, I would have been farther, he might not have left soccer. He just the anxiety and the depression and the way he was living, the alcohol, the smoking, the crappy food was messing with him emotionally, that he just did not have the emotional fortitude to continue. And he wants to help kind of younger kids. He's like, look, if I can help make these kids stronger, 99% of them are never going to get to where he was, but if I can make them stronger and more capable adults, he's thrilled.
That's awesome. We've been thinking about if we can do we don't take anybody under the age of 15, but we've been thinking about doing like a youth program where it's not totally like a group setting type of thing, hang out and just talk about basic stuff about food, just to be able to guide people at a younger age, because why do they have to suffer like I did till I was, 30 something.
A group format for kids might be perfect, because I think when it comes to children, the biggest issue, it's an issue for adults, but children in particular is the whole peer pressure that all my friends are eating pizza and potato chips lunch, and soda.
Right? And the school lunch is miserable, right? My kids have meatless Monday and pizza Friday, right? And they're in the meatless, it's a disaster. When literally we have trials in kids showing that including meat improves IQ. Right? Literally, we know that including meat in a diet for kids improves IQ. So anyway.
So what is it that you think keeps people from hanging on to these biases despite current clinical research and despite the lived experience and anecdotal evidence? Why are so many just stubbornly not willing to let go, or at least admit that this works for certain people, and to embrace it and be like, God bless, it works, rather than the constant arguments?
Yeah.
Well, it depends on the camp. So the vegan people, so the doctors are worried about the LDL increase. Okay. The vegan crowd and plant-based crowd is worried about saturated fat in animals, right? Okay. And, the environmentalist crowd is worried about the impacts on the environment, even though those may be false, right? And the people who are energy dynamic based that have taken grants from Gatorade and, General Mills and Kellogg's, right? So they've invested their careers on proving that, thermodynamics is at the heart of it, when probably thermodynamics is just like the vehicle, right, for which hunger and appetite is being expressed. So they're focusing on, so they've developed their entire career on, and it's a partial truth. They're all partial truths. That's the problem. Right. So they're all partial truths. And so I think that those are the biggest, voices against low carbohydrate approaches. And then the low carb community has never really coalesced. It just, this year we've set up the Society of Metabolic Health Practitioners. We had no physicians, PAs, health coaching, dietitian, organization. Like the American Dietetics has got somebody, American Heart Association has got somebody. Vegans have, the PBA and whatever, all these, advocacy groups. So we never really had anybody. And so this year, I'm on the board of directors for the Society of Metabolic Health Practitioners. It's been a passion of mine to educate doctors, nurses, dietitians, health coaches on metabolic health. And you see, it's really, we don't have a home base, like the vegans, for example, in New York State, they literally lobbied the state and got a state mandate that you have to have a vegan option in every hospital. Okay. And still to this day, there is no low carb option in any New York hospital, right? That just shows you how poorly organized this community has been. And so part of what I'm trying to do with my wife, by the way, to come back to my wife. So, 5 years ago, after I lost the weight, my wife was like, wait, I've been making you these low carb pizzas. I've been making you these low carb, cookies, and not that I would eat them all the time, but like, if it's regular pizza versus low carb pizza, my decision is very easy, right? I don't think that any of these are truly an ideal, but there could certainly be a stepping stone. She saw what happened to me, and she's become evangelized. She has a company now where she, literally makes mixes that people can buy, to help support them go from processed crap to low carb, and then low carb to real, when they go from low carb to real food, that transition is really easy. I think the biggest hurdle is processed food to low carb. So she's been evangelized. She's been working with me to reach out to restaurants, to reach out to people just to offer low carb options. We've worked with a restaurant nearby to make something with zucchini noodles. It's an Asian restaurant, use zucchini noodles. And, a pizzeria locally, they've used her mix to make low carb pizza, right? So now we have somewhere, like a way to support the people that are on this journey. Like we're taking it to the next step. Like we can help you pragmatically, but at the end of the day, like, what do I do when I want a pizza, right? At the end of the day, what do I do when I want buns for my hamburger, right? Okay, well, how often are you going to do it? Most people will answer as often as they need to, right? And that's maybe like once or twice a month, right? Or even less. Now I don't use any of that stuff anymore, right? I pretty much eat steak and vegetables. But so I think we're trying to create this community, we're trying, my wife's become entrepreneurial in this field, it's Rosette's Mix. And like, we're just trying to take this and then setting up the SMHP, like we're trying to make low carb stick, because when Atkins was around, he did a great job, but then his company was sold 10 times over. It basically become bastardized. And when he left, there was a huge vacuum in New York, which is where I am. There's nobody doing this. So now it's me and my wife, and we're trying to pick up where he left off. I think a big part of this is there's been no grassroots effort. I mean, Mark's son has been great. I mean, Mark's Daily Apple, Primal, the Primal brand, his books, right? So that he's done it, and then we just got to continue that really in all these other areas.
I didn't realize you were one of the leaders at the helm of the Society of Metabolic Health Practitioners. I joined that when it first came out.
We're going to do a lot of great things. We have a lot of good things planned for it.
That's awesome.
So, we're going to do much more education, conferences in every city. We're going to have a fellowship, so where people can like literally come train in an office for a month to 2 months and see what metabolic health coaching and metabolic practicing actually is. So there's a lot of good things that are going to come. It just needs time and support, and we're getting there. We're getting there. And just so you know, a big part of what made that happen was Keto Mojo.
Mm-hmm.
Right? Not everybody knows they their nonprofit gave a big donation to get that started. We've had a lot of donors and grassroots people like you and I who've joined, but we need an advocacy body. I mean, there's been the Nutrition Coalition on the government side, but we need to bring it all together.
Yeah. Awesome.
Sorry, I'm yapping away here, guys.
No, but if you wouldn't mind, I would love for you to give us a little bit of a glimpse of your program and how you incorporate health coaching working with people. I think that's what I think a lot of our listeners would also love to learn and hear about.
Yeah, so we have two programs. Well, we have a lot of programs, but we're going through a major rebranding and stuff like that. So just bear with me here. Our health coaches are intimately involved. So first of all, our health coaches are stars. Amy Igus, okay, she's lost 230 pounds and kept it off 5+ years. Okay, amazing story. She's written on our blog, countlessly on what it's like to be stuck in the chronic diet culture. Brian Wiley is one of our health coaches, and he has kept off 100 pounds for 12 years. Okay. I mean, so they are both inspirations. Every single person in this office has been inspired. Our marketing guy, Chris Cornell, who's awesome, literally lost 100 pounds, on low carb, reversed his diabetes, cancer survivor. I mean, every single person. My brother lost 150 pounds and he helps out with the design work. My wife with her migraines being resolved. Literally everybody lives and breathes this. And not to say we're not open, to other paradigms, but, we are all believers of lifestyle. Our manager, Talene, she's had her own, health issues resolved with lower carb eating. Her husband's lost weight with low carb eating. Father-in-law's reversed his diabetes with low carb eating. I mean, literally, it is like a true, we're basically an organization that's like lives and breathes this. Now, we have a number of programs that are just coaching. Okay. We have a live group, which is a low monthly way for somebody to just get involved, right? We get you a scale or a CGM and you join a big group meeting once a week. You have an individual meeting with the health coach, and then you come into our big group meetings, which could be anywhere from 60 to 150 people, right? And we have a curriculum that we go over exactly what we're going to discuss every 2 weeks. We give the show notes and kind of what we talked about. We publish those. And that's all pretty much led by our coaches. We have small focus groups. It's called a small group, which the health coaches lead. And they're like 8 to 10 people for 1 hour, literally going through, their struggles and victories for the week, kind of in a group environment where you get feedback from peers and you make those social bonds that are so critical to make long-lasting change. And we really encourage families to come, and we really encourage friends to come, because we know that makes the chance of maintaining this over the long term higher. Then we have, personalized health coaching, like one-on-one, right? So if you want one-on-one, it's going to be a premium, right? I mean, you're getting the health coach's time. And then if you switch over to the medical side of things, if you're a medical patient, whether it's primary care, virtual care, remote care, you have access to our health coaches. So you can talk with them basically 5 or 6 times throughout the year in 5 or 6 sessions just to keep you going. Or you can participate in these small focus groups, which run for 2 months at a time. And then finally, we have our medical weight loss program, which is an intensive 6-month weight loss program. And the health coaching is all throughout that program. I mean, basically you have, weekly meetings up front with a health coach, and then, kind of spaces out thereafter after the first several months. So there are every single program, whether it's medical or just coaching, we are using health coaches. because it's one, there's no other way. There really is no other way. And I have to be honest, without them, there would be no practice. And I really mean that. Without their support, this wouldn't be possible.
Well,
so they're just immensely valuable. I you know, they're like I feel like they're my brother and sister.
Oh. Tell us more about why they're so invaluable. What is it that, in your estimation, the health coach is bringing that is so invaluable?
Yeah, one is empathy, right? Two is they've walked the walk, and three, you know, the contact and the feedback and the ability to sit with a patient. You know, our health coaches, we have a way of doing our program and a way of assessing clients, right? So the ability to assess, you know, which defenses we need to put in place in every single patient to maintain their lifestyle, which ones are at risk of falling, right? Which ones are really strongly developed and they can kind of rely on. And the feedback, that impartial feedback of, okay, you know, like, let's say this week, you know, yesterday my back was killing me and I, you know, ate a Quest protein cookie, right? I consider that a failure, right? This point in my eating journey, like stuff like that is very rare, like once a month or less. And then I talked to Amy, I'm like, I can't believe I did this, you know? And, you know, Amy's like, well, what would have been the alternative? And the alternative would have been eating my kids' crap, right? I mean, which our kids don't have a lot of crap, but like, whatever, you know, pick your poison, right? And she's like, well, it sounds like it was a win, you know? And so having that like sounding board to kind of help you decide, you know, should I feel proud of myself or could I have done better? And in that situation, I couldn't have done better. And without that feedback, I would have been lost. I would have been like down on myself, terrible, you know, but really like, okay, I had a protein cookie and like, otherwise I would have like binged on ice cream, you know? So I think the value of a health coach is multifactorial. It's one, making that risk assessment, two, the empathy, accountability, and the, you know, the constant feedback, but then three, also anticipation of that risk assessment, and then the analysis, right? The analysis of, okay, where do we go from here? What do we improve? And then honestly, like being able to call them in a heartbeat and say, like, I need help. You know, we don't have anywhere else to turn to. Being able to text and say, I need help. You know, where else are the people going to turn to? So there's nobody else doing what we do.
Yeah. The story of your cookie is so interesting because I'm sure Laura can really, I have that conversation with clients all the time. Like they will declare a week an entire failure because they had creme brulee at the steakhouse for dessert. It's like, okay. And what they didn't fail to mention is they ordered their steak without the potato and they had doubled up on the asparagus and the creme brulee. It was their anniversary. Anyway,
yeah,
the point being they worked.
Right. It's the shame and the blame and the guilt, right? And the all or none thinking. Right? That's the enemy of a lifestyle transition.
Exactly.
Right? It is the enemy of a lifestyle transition. And they need you. They need you to say, like, how did I do? And you need to help frame them.
That's right. I mean, it's a muscle they've literally never trained. The muscle of recognizing that they made a good choice in a scenario, that they've chose the lesser of two evils, whatever. Because we're so quick to just jump into that shame spiral, and diet culture did that to us. So it's not even our clients' faults. But to me, it's like, I'll have this conversation until I'm blue in the face with every client until they get it, because once they get it, once they start training that little muscle and it gets stronger, that's their self-efficacy muscle. Then they can go off into the world and make food decisions like it's no big deal, which it kind of isn't a big deal when you extract yourself from diet culture.
That's right. Mike, you know that you've won when you can enjoy an ice cream cone with your kids one day at the beach and then not let that spiral into a whole pizza and a milkshake and waffles the next day. And you just enjoy it for what it is. It was the experience. It was fine. And you just moved on. Guess what? It is a non-event, right? Because you know what to do now. You know, you're not looking at it as a cheat anymore. You just realize that, you know, I enjoyed something with my children. It's not something I normally eat, but it's not going to disrupt the rest of my life. But that to kind of tag back to a lot of what we were talking about earlier, that kind of stuff is what takes time to get comfortable with. And this is the role of the coach. on helping the client reframe their own story and that language and the way they speak to themselves in their own head. That's what health coaches are so necessary for, because it's that shame spiral and that internal dialogue that sends people into real failure, right? That when they really give up rather than just moving on.
And then the other side of it is when they could actually improve,
Yeah.
right? So like, I've been eating that Quest cookie every day this past week. Well, why are you doing that? You wouldn't like, hit the, in case, break the glass in case of emergency every day of the week, right? You wouldn't, leave a spare tire on for a week. You'd go get it fixed, right? So, I think that's also the role of coach, is figure out, okay, when to,
Right.
when to say, hey, now it's time to improve, and so it's critical. We again, like I said, there is no Dr. Tro without Amy Igus and Brian Wiley. And, we're looking to we'll probably bring on at least one more in the next 6 months, one more health coach. We're currently interviewing a trainer / head coach, health coach right now.
Awesome. Awesome. This has been so great and so enlightening. And I want to thank you for, I guess, just sharing your passion for this. Don't worry about the bullshit and all the swear words. That's not a problem. I think our audience finds it, at least I do anyway, I can only speak for myself, refreshing to hear someone as passionate as you are about this and not being afraid to kind of lay it out there, And I also want to thank you for giving health coaches a voice and for making them like a preeminent part of your practice. And the language that you use to describe how Amy and Brian are so integral to not only your practice, but the outcomes of your clients. So thank you for that.
Yeah, it's the truth. And the reality is, look, there's medications I have to review. There's things I wish I could coach everybody myself. That's the type of relationship I'd love to have, but I just can't. I can't. So we need to rely on well-trained people. We need to rely on people who understand the vision. And speaking of giving them a voice, we have a podcast coming up called Escaping Obesity, which is going to be me, Amy, and Brian. So check that out when it comes.
And you have another podcast, don't you?
Yeah, the Low Carb MD podcast. That's with myself and Brian Lenskis, another physician. But this one will be literally, we're going to be offering free care to people, and we're going to be documenting people's journeys over, like 6 months each. So it's literally going to be a podcast of what we do, right? So like what happens behind the scenes and what do those patients feel, and, how it is we coach them. So I can't wait to do it. I'm really excited about it.
Awesome. Where are people going to find that? Just a podcast player?
Yeah,
or is it going to be like a YouTube thing, or?
Yeah, maybe in a couple months it'll be on iTunes. We'll probably have it all done by then, and ready to start with our episode. It's going to be like a real, I don't want to call it, it's going to be good. Yeah.
Can't wait.
Yeah. I'll just say it's like the good 600-pound life,
Oh,
like the good, my 600-pound life. That's what's going to be.
I love that.
So,
that's a bit of a renaissance, shining a positive light on the stuff.
Yeah, we're going to make it how it should have been done.
Well, my mom thanks you from beyond the grave. Creepy, but here's my praise for the day.
No, that's sweet. I love that. So where can people find you and follow you and hear more about kind of what you're doing and the research you're looking at? Because, this comes up in our group a lot. People that they ask for access to, has anybody seen a study that, and this one comes up a lot, right? As far as the efficacy of a low carb diet on particular disease states, or just, so.
Actually, if you go to our site, so I've literally compiled all the studies on my site, drtro.com/studies. And I have like a 1-line blurb and then the citation, like about what those studies are showing. And on there is also the studies we did on severe hypertriglyceridemia, binge eating. We have one on glycemia that's coming out. So there's, I don't know, over 50 studies, all kind of segregated there. So Dr. Tro spelled out, like doctro.com/studies. And then if you need to get in touch with me, so that's for like all the studies. And if you need to get in touch with me, just social media, Dr. Tro spelled out, any social media, somebody will respond to you and I'll get back to you. You can also text the office. If you need CGMs, that's the other thing. We're now licensed in like, I don't know, 40 states, or I don't know how many states now. So if your clients are looking for CGMs, we can definitely help them get CGMs.
Yeah.
And, you know, we can write the script and ship it out to them. So happy to help.
What a great resource. Yeah, I've got mine.
Yep. Perfect. Yep. There you go. So, you know, I'm just curious, how much did you get it for?
I pay $80 a month for 2 sensors.
$80. That's pretty good, actually.
Yeah.
That's pretty good. So some insurance, some people don't have insurance. Do you use the GoodRx or use like cash pay?
That's just what I pay at CVS.
Yeah.
So my doctor, also a telemedicine doctor through SteadyMD. And when I told, you know, he knows I'm a health coach and he knows I'm a fitness coach and I'm kind of a geek about this stuff. And I beta test different dietary strategies and I try to see how combinations of food affect me. And this is what happens. You know, I just kind of like to track that stuff. And he was all for it. So he just prescribed it, but I'm not diabetic. So insurance won't pay for it. So I just pay out of pocket and it's about $80.
That's not bad. That's not bad. The reason why the pharmacies are able to give a cheaper price is, you know, Abbott actually gives them a rebate. So we basically pass it off at cost. But if you're able to get a prescription and go to the pharmacy, usually you get a cheaper price than we can.
That's good to know. But what a great resource and a great offer for health coaches that are looking to find a resource for their clients.
Yeah, absolutely.
So thank you. What scale do you use, by the way? You were talking about a scale.
We use a platform called Cardio, which is a body composition scale. We're very happy with them just from a data analysis standpoint. You know, there's better scales. There's like 4-point body composition scales that give you visceral fat, but none of them are really telemedicine compliant. Mm-hmm. So we use Cardio. Just the reason why we use Cardio is because it's telemedicine compliant. Yeah. You know, we're integrated with them. We're integrated with Keto Mojo. We're integrated with Biosense. We're integrated with Abbott. We're really the first fully integrated metabolic health practice. I
love it.
You know, and we were the first ones to work with Abbott. We're the first ones to work with Keto Mojo. And I think Biosense has worked with some other clinics, but we're pushing the needle, trying to make this completely remote, available to everybody anywhere in the country.
I love it. Yeah. Awesome. Thank you again, Dr. Tro. This was a blessing. Thank you.
Yeah, no, thank you guys. I'm happy to come back anytime, and hopefully, if any health coaches, just send us your contact. We're always looking to help.
Awesome. There you go.
All right.
Thank you.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.
Well, if you've been listening at Health Coach Radio, you'll know that we're all about raising the voices of practicing health, fitness, and nutrition coaches, but most importantly, helping to further legitimize this exploding industry. Erin and I have disclosed often that we're on the faculty of the Primal Health Coach Institute, founded by none other than the health and wellness legend, Mark Sisson. And we've interviewed dozens of guests from just about every different health coaching program you can think of, and who practice in just about any conceivable way you can think of. But our allegiance is to the health coaching industry in its totality, first and foremost. It's our desire to continuously and unapologetically lift and promote this industry that nudged us to create this podcast for you in the first place. It's this same yearning that encouraged us to take the educational offering at our health coaching school to the next level. We are so proud to offer the Primal Health Coach Level 2 certification course, which when combined with our primary course, the Primal Health Coach Certification course, not only satisfies the educational requirements to sit for the board exam, but is specifically designed to teach advanced coaching mastery. You will work closely with a small class of peers through this 12-week, very intensive live online classroom experience to learn how to execute a coaching relationship that is truly transformational. You'll learn and practice how to ask powerful questions, what it means to hold space for your clients, but most importantly, how to actually do it. You'll learn about the craft of motivational interviewing and the nuances of habit change, goal setting, and accountability, and how to nurture your client's own inner knowing, their intuition, and their own self-efficacy, so that they will graduate from your care a truly transformed person. You want a big, successful, powerful coaching practice. And maybe you're devouring our episodes looking for the silver bullet that's going to launch your business into the upper echelons. We've said it a million times and we'll say it again. Your coaching skills are what will make or break you and set you apart for success in this field. So if you're looking to level up your coaching skills and maybe dial up your credential and become a board-eligible health coach, look no further. You can learn more about PHCI's Level 2 program at primalhealthcoach.com/Level 2. But if you would value talking to a real person about your path to being a masterful coach and perhaps a board certified coach, book some time with me personally. You can access my calendar at primalhealthcoach.com/call. Or just call me. You can reach me at 844-307-7662. Thank you for listening to Health Coach Radio, and I hope I get to talk to you soon.